Welcome to the Journal Club for this week. This article titled The 5-Year Outcome of Root Canal Treatment Comparing Sealer-Based Obturation with Calcium Silicate-Based Sealer to Continuous Wave Condensation. It's a randomized controlled trial that was done by a Korean group and newly published in the JOE. Canal irrigation and shaping are a critical component in the prevention and treatment of apical periodontitis. In the recent years, calcium silicate-based sealer have gained significant attention due to their bioactive and biocompatible characteristic. So this study aimed to evaluate the long-term clinical and radiographic outcome of both technique and investigate the factor influencing the long-term success. Coming to the material and method of this study, the selection criteria include the healthy participant who were either ASA 1 or 2, patient aged 18 year or above, and who were asymptomatic or had mild symptoms before root canal obturation. The patient were recruited between April and September 2018. The randomization was performed using a computer-generated sequence. Each participant was randomly assigned to either continuous wave of condensation obturation with AH plus sealer or sealer-based obturation with tricalcium silicate sealer. The post-obturation pain was recorded using a numerical rating scale at 3 times point, which was 4, 24, and 48 hours. And then they categorized this based on the highest score that across the 3 points, either to be none when there is a complete absence of the symptoms, or mild when there is a slight discomfort, or moderate when there is a noticeable discomfort that's require analgesic, and severe when there is a severe pain that was not responsive to the analgesics. The participant underwent both clinical and radiographic examination and were evaluated by 2 calibrated examiners who were blinded to the treatment group. The radiographic evaluation was done using a periapical index scoring system. Coming to the result, 60 teeth were available for evaluation at the time of 5 years follow-up, giving a recall rate of 64.5%. The mean follow-up period was 62 months. The survival rate for the continuous wave condensation group is 97%, and for the sealer-based group it was 88.5%, with no significant difference observed for the 2 groups in the demographic and clinical characteristics. Also, no significant difference were observed between the 2 groups in the technical parameter, which include the post-obturation pain, the length of the filling, and the sealer extrusion and the voids. For the 5-year success rate under the loose criteria, it was 93.9%, and under the strict criteria, it was 76.8%, with no significant difference in between the 2 groups. For the multivariative logistic regression analysis, it shows that the pulp status, the post-obturation pain, and the sealer extrusion were the 3 most influence factors for the long-term success. So to conclude this study, sealer-based obturation technique with tricalcium silicate sealer demonstrate a comparable 5 years outcome to continuous wave condensation technique, and this support that sealer-based obturation is a less technique sensitive and a clinically alternative technique for obturation. Keeping in mind also that a larger scale randomized controlled trial should be done to strengthen these findings, and thank you.